Hello,
Hi.
my name's Shelby. I am a student nurse at Oakland University, and I just wanted to talk to you and get a health history from you.
Okay, sounds good.
Okay, so what is your first name?
My name is Paige.
Okay, and can you spell your last name for me?
Yes, V-E-R-B-R-A-S-K-A, Nebraska.
Okay, and what's a good telephone number for you?
616-389-9142.
Okay, and an address?
123 Mayward Lane.
Okay, awesome. And what is your birthday?
March 5th of 97.
Okay, and where were you born?
Grand Rapids.
Here in Michigan?
Yeah.
Okay. And so that would make you 25, right?
Yes, almost 26, but
Okay.
we'll say 25.
And what gender do you identify as?
Female.
Okay. And are you married or divorced?
I am not married, single.
Okay. And what's your current occupation?
I'm a student,
Okay.
so unemployed.
Okay. And what race or ethnicity do you identify as?
White.
Okay. And do you have any complaints or symptoms today?
Nope, just getting set up.
Okay. Awesome. So, how would you describe your general health?
Good. No issues. I mean, it is winter, so just the occasional cold, but nothing
Okay.
of note.
Well, that's great to hear. Going back to your childhood, I know it's kind of a long time ago.
Yes.
Do you have any illnesses you can remember?
I do know I had chicken pox.
Okay. How old do you think you were then?
I know the story. My grandma took care of me. She passed away in 2001, so it had to be like 1999, something around there.
Okay. And anything else you can think of other than the chicken pox?
No, I think that is it for childhood.
Okay. And moving on to accidents or injuries, anything like that happen when you were a kid?
I broke my pinky when I was probably about 7 or 8.
Okay. And
Nothing crazy. And then when I was 13, and then again when I was 15, I had 2 knee dislocations, both on the left side.
Wow. Okay. And any accidents as you got older?
No.
Okay. How about any serious or chronic illnesses?
Nothing really. I mean, I do struggle with depression, but that's kind of, on and off.
Okay.
Gets better, gets worse, so otherwise.
Is it well controlled right now?
Yes.
Okay. And at what age do you think that started at?
I was probably 13.
Okay.
When all the other accidents and all my other injuries happened. It was kind of all at once and became a little bit too overwhelming.
Yeah, 13 is a hard age.
Yeah.
So, have you ever been hospitalized for anything?
Yes. So, also when I was 13, adds to the whole depression issue. I contracted C. diff.
Okay.
We're not really sure how, but that ended up with me staying in the hospital for 2 to 3 days.
Okay. Wow. Yeah, that's rough at that age. And what about operations? Did you have any operations on your knee?
Yes, I did. I had a tendon reconstruction in 2012, I believe, and haven't had any issues since.
Okay. And any procedures when you were little?
I had my adenoids removed and ear tubes as well.
Okay. And have you ever been pregnant before?
No.
Okay, so we will skip all of that.
I hope it didn't stop. Okay. We'll just not show this part.
Looking at immunizations, are those all up to date?
Yep, any time that they are due, I make sure to make an appointment and get them. So I've had all my childhood vaccines, even up to like adulthood, and I have had a total of 4 COVID vaccines. 3 of them were Moderna, and the last one was the bivalent booster for the Omicron.
Okay.
So, hoping
Okay.
I'm covered.
Yeah. When was the last time you saw your primary care doctor?
That would be, I think, September of 22.
Okay, so pretty recently.
Pretty recently, yeah.
Do you have any allergies you're aware of?
I am allergic to any and all penicillins.
Okay. And what reaction do you usually get with those?
Hives, usually widespread on the arms and upper body.
Okay.
At least that's what I remember.
Okay. And are you currently on any medications?
Yes, I am on Zoloft for my depression.
Okay. And what dosage is that?
That would be, I believe, 50 milligrams.
Okay.
And then microgestin and birth control.
Okay. So taking those daily then?
Yes.
Okay.
Yep, every day. I usually take them at night.
Okay.
It's easier to remember for me.
And then, so looking at your family instead of yourself, I'm just going to list off some common illnesses, diseases, and you just let me know if anyone in your family has had them. So heart disease?
No.
How about high blood pressure?
That would be my maternal grandmother.
Okay.
And quite possibly my maternal grandfather, but he doesn't tell us things.
Okay. And what about a stroke?
My maternal grandmother, but luckily it was just TIA, and they were able to adjust some things, and she's hasn't had an issue.
Okay, awesome. And how about diabetes?
Nope. Nothing in history.
Okay. Blood disorders?
Nope.
Okay. And how about anyone with breast or ovarian cancer?
Yeah, so both. Most importantly, my paternal grandmother got diagnosed with breast cancer probably like 1989.
Okay.
Suffered with it on and off for over 10 years, and sadly passed away.
I'm sorry to hear that.
In 2001. So she had a good fight. Ovarian cancer is also on my family, but it's more further back. So nothing to really say.
Okay. And how about sickle cell anemia?
No.
Okay. And arthritis?
My mother has some osteoarthritis, but nothing debilitating, just kind of wear and tear.
Okay. Any serious allergies, drug allergies in the family, other than you with your penicillin?
Now that I think about it, my father is also allergic to penicillin.
Okay.
But other than that, they're the only ones in the family.
Okay. Any seasonal allergy issues? Speaking of allergies.
Nothing that we've been diagnosed with. You know, like the normal, we take like over the counter, and it's fine. Nothing that you need to go see an allergist for.
Okay. How about asthma?
No.
Obesity?
No.
That's great. Alcoholism or drug addiction, does that run in the family?
No.
Any history of mental illness in the family?
Besides me.
How about suicide?
No.
Okay. Seizure disorders?
No.
Okay. Kidney disease or tuberculosis?
Neither. No.
Okay, great.
We're a fairly healthy bunch.
That's good. Now we'll just look at your, we call it review of systems. It's just going pretty much through all the different body systems. So I'll just list a couple things and you let me know if anything rings a bell.
Okay.
Do you have any present weight issues, whether it's losing or gaining weight?
No.
Okay. Any issues with fatigue or weakness?
Yeah, not weakness, fatigue. It's been a long time since I've, woken up and felt well rested. I'm usually pretty tired. I've had, blood work and everything, and I'm very healthy, so we're just trying to figure it out.
Okay. And do you ever have a fever, chills, night sweats?
No, I mean, I do wake up sweaty.
Okay. Just at nighttime?
Just at
you
nighttime.
have problems
Usually
with it? Okay.
very warm at night, but nothing that causes me concern.
Okay. And how about your skin? Any skin issues? Eczema, psoriasis?
No.
Any pigment change?
No. I do have issues with dryness, but I think that's winter.
Okay.
Just
Yeah, so nothing crazy.
No, I've never had to see a provider for it.
Okay. And what about your hair? Any recent change in your hair texture? Any loss of hair?
No.
Okay. Nails? How do your nails feel to you?
They are the same. They break pretty easily, but nothing. They're not falling apart. They're not. They get caught easily.
Okay. Okay. And do you feel like you get enough sun exposure?
No. Yeah.
When you are out in the sun, do you wear sunscreen?
Absolutely.
Okay, that's awesome. And do you have a skin and hair routine that you take? You wash your hair, wash your face, that kind of thing. Okay. Any
I try to shower once a day.
Yeah.
At least.
Any complaints dealing with your head, severe headaches, head injuries, vertigo?
Nope.
Okay. Moving on to the eyes. Do you have any problems with vision?
Yeah, there was a time when I was nearsighted, I believe, but I kind of grew out of that, so I don't need contacts or glasses anymore.
Oh, wow.
But I still have a little bit of an astigmatism, so they recommend that I wear, I have a special pair of glasses, when I drive when I drive at night especially, but other than that.
Okay. Sorry. And you don't have any watering, discharge?
No.
You haven't been diagnosed with glaucoma, anything like that? Okay. And how about any earaches, drainage, ringing in the ears?
No.
Okay. You don't wear hearing aids, anything like that, right?
No.
Okay. And how about your nose? Any frequent nosebleeds, sinus pain, allergies?
Yeah, there was a time in my life where I was getting multiple sinus infections a year for several years. Ended up getting, scans and all that other stuff. And it just showed chronic sinusitis and a small polyp. But since I got treated with some steroids and stuff, I really haven't had an issue since then. Every once in a while. This past winter was especially bad, but other than that, luckily, been.
Okay. And looking at your mouth, any problems with toothache, any lesions you've noticed on your tongue or in your gums?
No.
Any difficulty swallowing or eating food?
No.
Okay. When was the last time you went to the dentist?
That would be August of last year, so 22.
Okay. Any
A
issues?
family friend is my hygienist, so
Oh, nice.
anytime it's time, she'll send me a message directly.
Oh, that's
and
nice.
then put me on her calendar without really asking. So.
And how about your neck? Do you experience any neck pain? Are you able to move it pretty freely? You don't have
No
a goiter?
issues.
You don't have any swollen lymph nodes, not a tender or anything right now?
No.
Okay. And with your breasts, have you noticed any lumps or pain, any discharge coming from your nipples?
No.
Okay.
No.
Do you usually do a self-exam?
Yeah, pretty frequently with my extensive breast cancer history. That goes further back than what was asked. I'm very on top of it, and then also when I have my yearly gynecological exam, I have them check as well.
Perfect.
I'm not the professional.
Right. That's great. And you haven't gotten a mammogram yet because you're too young.
Told 30.
Okay. And no problems with your axilla or armpit area?
No.
Okay. And how about looking at your respiratory system? Any wheezing, constant coughing, any difficulty breathing, chest pain? Have you had pneumonia before?
I have had pneumonia before. It wasn't anything serious. It was contained to like one small area of my, I believe my right lobe. I was helping take care of my mom who had gotten pneumonia and had unfortunately got it from her. So.
Okay. And
completed my course. So.
Okay. Awesome. Moving on to your cardiovascular system, do you have problems with any chest pain? Have you been told you have a heart murmur, high blood pressure? Didn't sound like you took anything for any of these issues.
No, everything has been good.
Okay.
I have no problems.
You don't see a cardiologist, no EKGs? Okay,
no.
Awesome. And moving on to your vascular system, do you have problems with being cold and numbness, any tingling of your extremities, like your toes and fingers?
Well, I'm always cold, but nothing that causes any problems. It's just like a whole body thing. I'm always cold.
Okay. I know you're not currently working, but when you were working, did you ever use any like preventative measures?
Yeah, so I would work 12 plus hour days running around, so I have quite the stockpile of compression socks, and they are a lifesaver.
Yes, they are. Moving on to your GI system, do you feel like you have a proper appetite? And do you have any heartburn, bloating, issues with food intolerances for, maybe gluten or dairy?
Yeah, dairy doesn't agree with me the best.
Okay.
I can tolerate small amounts, but can't just sit down and eat a whole glass of milk, or drink a whole glass of milk, I should say, without having issues. It usually just ends up with some bloating and some discomfort, nothing crazy, so I just try to avoid it as much as I can.
Okay. Any issues with your bowel movements, constipation, diarrhea, that kind of thing? Using any antacids like Tums or laxatives?
Occasionally, but not enough to
have
say
concern.
It's a pattern, yeah.
Okay. And
I use it when I need it.
Right. With your urinary system, do you have any problems with your frequency? Is it ever have like a smell to it or a certain color? Are you having any pain in your flank area where your kidneys would be? Do you have any problem with incontinence or peeing, getting up and peeing in the middle of the night?
That I do.
Okay.
But I feel like it's more related to the my sleep patterns. It's not like it wakes me up because I have to go. It's like I'm already up, I'm already awake, might as well go.
Yeah. And then we can skip obviously over the male genital system. Looking at your menstrual history, how old were you, do you think, when you started getting your periods?
I believe I had just turned 13.
Okay.
I believe.
Okay. And when was your last menstrual period?
Started yesterday.
Oh, lucky you. Are they normal? Do they come once a month, every month? Or not really?
Yes, because of the birth control
Okay.
that I'm taking. That kind of keeps me regular. Otherwise, no.
Okay. And when you have your period, are you experiencing any symptoms?
Yes. Bloating is pretty bad. I have some cramps. And then the usual, mood swings, irritability, that kind of thing. Just all around just not happy. But,
Okay.
I'm pretty used to it by now.
Okay.
Deal with it.
And do you get a yearly pap smear?
Yes.
Okay.
Yep.
Okay. That was back in September then?
Mm-hmm.
Okay. Awesome.
And it was normal.
Okay. Excellent. And we will skip over the sexual health. And any issues with arthritis, joint pain, range of motion?
Not really. I do have issues from time to time in the knee that I had surgery on.
Okay, yeah, that makes sense.
Just like the occasional stiffness or kind of pain. Usually has to do when it's really, like, the moisture in the air is really high, when it's, at least that's what I've noticed. So I just kind of have, deal with it.
Yeah. You're able to do all of your, like, daily activities by yourself?
Mm-hmm.
Okay, like walking and brushing your teeth,
it doesn't
combing your
affect
hair.
me quite that much.
Okay.
It's more of an annoyance, really.
Okay. As far as your neurological system, do you have any history of stroke, fainting, blacking out, seizures? I know you mentioned depression earlier.
Mm-hmm.
Anything other than that,
No.
than depression? Okay.
No.
And have you noticed any problems with bleeding, excessive bruising?
No.
Okay. How about...
No, I'm just clumsy. I always end up finding bruises that I don't remember how I got them, but they're not everywhere.
And I know you said you were, are always cold, but you don't have history of diabetes, and sounds like you don't, you're not concerned with any tremors or hair distribution. Okay. So moving on, what's your education history look like? What was the last grade that you finished?
So I have my bachelor's degree from Central Michigan University, and that was in 2019.
Okay.
When I finished. And
do you have any other license or certificates?
I have my nurse's assistant's license through the state of Michigan that is still up to date and current.
Okay.
I try to keep that up.
Yeah, that's great.
Even though I'm not working.
Hey, it's always good to have. For your financial status, do you feel like it's adequate for your lifestyle?
Yeah, with my previous work, I was able to save up quite a bit, and I have student loans, and if push comes to shove, I have family that will help. So
awesome, that's good to hear. And how about your value or belief system? Are you a religious person, would you say, or a spiritual person?
Yeah, I was raised Catholic.
Okay.
I haven't been to service in a while, but I'm a big believer in it's kind of wherever it can be wherever you are. So
I agree. That's awesome. Looking at self-care behaviors, what do you do? What do you do for self-care?
I like to take baths, do yoga, puzzles, naps are a big one, kind of a reset, listening to music, anything to kind of take my brain away from what it's focusing on. So just kind of not necessarily to shut off, but to shut off my brain a little bit.
Yeah, I understand that. Moving on to your exercise and activity, what would you say like a usual day would look like for that?
It's basically, right now, it's just school.
Okay,
So I go
so
between
sitting
school
a
and
lot.
home, and I'm sitting a lot, and I do not exercise. It is a bad habit I have gotten used to, so I have to somehow try to fit that back into my schedule.
Okay, yeah, totally understand that. Life happens. And we already discussed you're independent with all your ADLs. What do you like to do in your free time?
A lot of what I previously stated. I am a big movie buff. Binging shows.
Nice.
I do like to bake.
Oh, yeah.
Thinking about it, but I don't do it that much because you need quite a lot of
Stuff and time.
and so that doesn't always happen, but I do.
Yeah.
I do enjoy.
And how do you feel about your nutrition? Do you feel like it's balanced, or could be a
It
little
could
bit
be.
better?
It could be more balanced, but I do make sure. I do love like fruits and vegetables, so that's never been an issue. But
Oh,
it's just
that's
kind
good.
of like the balance of everything, not eating.
Okay.
You know,
And
high fat
do you buy your own food and prepare it?
I do.
Okay.
My mom occasionally sees something that she thinks I'll like and buy it for me, but most of the time I buy all the food.
Okay. And how would you describe your role in your family?
Yeah, so I am a daughter and a sister, and I seem to be the one everyone calls when they want to like vent or complain or get something off their chest. So I'm a big support person in my family. It's always just kind of been the four of us, so we're all pretty close in different ways. So
Okay.
each person kind of has their individual thing. So
Yeah.
I'll call my mom for this type of problem. I'll call my dad for this type of problem.
Yeah.
My brother for others.
Do you live with your family?
I do not.
Do you live alone?
I live in a house with roommates.
Oh, okay, cool. Do you feel like you're getting along with everyone in your life, friends, family, coworkers,
Yeah, absolutely.
that kind of thing? Awesome. And where do you typically get your support from?
My mom.
Oh, that's nice.
Yeah.
Do you feel like you spend a lot of time alone daily, or not really?
Yeah, all my roommates were on our own schedule, different things, so we come and go pretty.
Okay. Is that an issue for you, or do you not mind it?
No,
Okay.
no.
That's nice.
I like to be with people, but I don't mind my alone time.
Okay. What would you say is your biggest stress in life right now?
Now it's school.
Okay.
Yeah, just
Okay.
making sure, getting everything done.
Yeah, definitely. And what do you do to take that stress away or reduce it?
I do a lot of self-care, some meditation. Me and my roommates, especially since it's been nicer out, have been going on a couple of walks.
That's great. And how about caffeine? Are you a pop drinker, or do you drink coffee?
I drink coffee and tea, both caffeinated and decaf. I usually only have like one caffeinated beverage a day.
Okay.
I do drink sodas, but it's usually non-caffeinated.
Okay.
I'm not a big soda person. Well, I guess I am, but caffeinated soda.
Okay. And are you a smoker?
No.
Okay. You've never been a smoker?
No, never.
Okay, awesome. Do you do any street drugs such as marijuana or cocaine?
No.
Okay. And how about drinking alcohol?
Yes, very infrequently.
Okay. How would you say, how many times a month typically?
0 to 1.
Okay.
Like I can go months without drinking.
Okay, so no one's ever told you you have an alcohol problem or
No.
drinking problem?
No, it's usually the opposite.
Okay.
It's like go out and with friends and go have a drink. And I was like, no.
Okay. And then we already talked about you live with roommates.
Mhm.
Do you feel like it's safe?
Absolutely.
Okay. You have access to a car?
Yes, I
Okay.
own my own car.
Okay. And do you use your seatbelt?
All the time.
Okay. Do you frequently travel to other countries?
No, I wish.
Right?
Yeah.
Were you previously in the military?
No.
Okay. And there's no hazards at a workplace, or how about for at home or at school?
No.
Okay. And then do you currently have a partner?
No.
Okay. So we will skip over the intimate partner violence. Do you have any history of domestic violence with your partner?
No.
Ever felt scared of a previous partner?
Nope.
Okay. And how would you define health?
Ooh, interesting. For me, I mean, health is just about being the healthiest you can be, with, having as little to no illnesses as possible.
Yeah, I agree with that. And as far as occupational health, we'll skip over that. You're currently not employed, so not relevant. What is your primary health goal?
It would definitely be to exercise more. I feel like that would help with another issue, which is fatigue.
Yeah.
Just gotta get over it.
Yeah.
Gotta deal with it and exercise.
And what would your expectation be of myself or another nurse, physician? What do you expect from them?
I mean, for me, it's the bare minimum, I feel like, but it's very important. Just to listen, not to get any ideas of what you think it could be without listening, and easy, and be able to be reached pretty easily. Because I don't always, even if it's just a simple question, I would like to be able to send an email or
yeah, totally
to
understandable.
get a response instead of waiting on hold forever.
Yeah.
And then they'll be like,
That's
"I'll call
never
you
fun.
back." Yeah. Accessibility, that's the word.
Yeah, awesome. Well, thank you so much for your time.
Well, thank you.
That is the end of the health history that I have. So have a great rest of your day.
Yeah, you too.